Chris Thomas. I'm in the nursing department. I was asked here to talk about some changing nutritional issues of caring or becoming an older adult. Most of my practice has to do with caring for older adults. Most of my clinical practice in the very beginning of my career started with working with open heart patients in the intensive care unit, pacemaker clinic, so a lot of cardiac and respiratory type of issues. And as it turns out, if you work with adult individuals, that happens to be the geriatric type of population. So helping them work through a lot of those type of issues, and then from a chronic disease standpoint, helping them in an outpatient care type of instances, and then now working with my students in long-term care and assisted living, helping older adults address the many changing issues having to do with them. And I do teach a healthy aging course here at the university for the nursing majors. So you guys identified that there were several different aspects having to deal with loved ones, having to do with changing adult type of things. So I can cover some of those and some of the disease processes. And if you have any kind of questions along the way, please just let me know. I'll cover sort of in the beginning some of the normal type of changes that all of us are going to go through as we get a little bit older. I know I'm struggling right now. I've been teaching about caring of older adults, and now I'm starting to deal with the vision issues that I always talked about and said that older adults struggled with, and now I am living it. So I do have a new empathy for those type of things. So we'll talk mostly about dietary type of issues today. I do want to let everybody know that everybody is unique. As you get older, whether you're younger, we have different needs, different likes, different dislikes, and again, different physiological type of processes, especially with, again, older adults and diseases. So I'm going to talk about, again, general type of things. I do want to make sure that if anybody's going to make any significant changes to their diet, you do want to consult your healthcare provider, especially any kind of specific chronic diseases. Because it can affect them in a certain way. I'll point some of those things out as we go along. But I've been to some presentations, just as one example, from a chiropractor, and I have a real respect for them. I go to them every once in a while to get my neck back into alignment. But when they start talking about curing asthma and things like that, that hasn't really been identified from research. You just need to be cautious about those type of things. Okay? So there are normal changes as we all get older. If you're not experiencing it now, your loved ones, as you identified, probably are. There is actually a change sort of in the body shape and the body makeup. We actually start losing at about age 30 muscle mass, anywhere from 5 to 10% of our muscle mass. Now, that doesn't mean that we can't make muscle, we just don't make it as well anymore. So if we have an illness or a decrease in our nutrition for a couple of weeks, where our protein issues, then that starts to diminish, and it's harder to make up the difference over time. So there is actually a change in also the basal metabolic rate. So they're a little more tired, you don't have as much vigor as you used to, walking up the steps is here in relation to some of those pieces. There's also a decrease in absorption of nutrients in the gastric system. So in relation to that, what you ate 20 years ago, the percentages of it are actually diminished to a certain degree. So you actually need to eat a little bit more so that percentages are remaining the same, because your nutritional needs over time do not necessarily change. But then again, you're not able to absorb them. There's also a change in the body water percentage in our bodies. Muscle is a large part when you're older when you're younger, having to do with body weight and also body water. Muscle holds much more water than fat type of tissues. So they have less of it. Therefore, when you talk about diluting things, which comes into the aspect of medications, they don't dilute them as much. And then not only that, as you get older, your thirst response, you just don't feel thirsty. So you don't remember to drink, and therefore, again, you're having a little bit more types of problems with dehydration. Because again, usually you don't want to necessarily have a drink until you notice different things within. I'm feeling a little thirsty. So those are some of the normal changes as we get older. And then there's some nutritional concerns. During illness, the intake of various nutrients is either self or medically restricted. So from a self standpoint, if I'm not feeling well, I'm not going to get up and get anything to eat. When everything comes to the table, I'm just been tired all day, and again, I'm not going to increase the amount I need to eat based on the illness that I have to try and fight it off. And then the medically restricted type of things. Again, chronic diseases, when we talk about aspects having to do with heart disease, a lot of low-fat type of things. So that, again, sort of cuts a lot of the things that they used to eat. It cuts a lot of protein sources in relation to some of the fats that we're eating in our diet. When you have clients who have a fluid overload issue, like with heart failure, well, now we have to restrict their fluid, when really fluid can be very helpful in other instances. If they have to go in for testing, people that have, again, problems just not feeling well, they want to do a colonoscopy. Well, what do we do first? We tell them not to eat anything for a couple of days, but granted, they probably haven't been eating anything for a week. So now this is over a week. And then we give them the prep. Has anybody seen the prep? Again, this fluid that cleans everything out. Okay, so now they haven't had anything for another couple of days. Then we have the testing, and then there's the treatment. So they're in the hospital, the food isn't very good. They're following up with all the treatment, they're not getting a lot of sleep. So this is a 2-week period now, just with a simple test sometimes. And if they haven't been eating for a period of time, the nutritional base has gone down. And now they're trying to heal. And they just don't have the resources to do it, so it takes a longer period of time. So in relation to the medically restricted, that can be, again, significant for them. And then again, the issues of acute illness, you actually have higher protein needs. Any kind of surgeries, well, we need the building blocks to make those cells. We need aspects of immunity in relation to the vitamins and proteins and nutrients to be able to fight the infection without, again, having to give them all the antibiotics and all the different other aspects that seem to have a bit of an assault to the body too. Does that make sense? Okay. We mentioned the dietary restrictions related to chronic disease. When you start restricting one thing, many times it is affected or linked to another. There are changing needs having to do with medications. There are certain medications such as antibiotics and many antidepressants that actually change the taste of various foods. It's bitter or it's sour, therefore again you're not wanting to eat as much anymore. Many types of medications actually block absorption of food. Not the cholesterol meds of the statins, however the other ones like, I don't know if you've heard of Questran, it actually blocks the ability to absorb the fat in relation to cholesterol levels, but then it also decreases your ability to absorb the fat-soluble vitamins, such as vitamin A and E and D. All right? So those type of things are an issue. Any kind of stomach upset, very common with any kind of medications. And most older adults, when we're caring for them, have anywhere from 8 to 10 medications. They're taking a fistful of medications in the morning. That's full to begin with. I'm always surprised how they can just take them all down. And research has identified that those with chronic diseases can actually take up to 30 different types of medication. Maybe not necessarily every day, but that's just a lot of stuff for the body to deal with. And again, it can really affect taste, what they're absorbing, and different nutritional type of needs. Then there's also the aspect, I don't know, does anybody have a family member sort of living alone at home? Or are you all sort of living in the same residence with your older adults?
Same residence.
Same residence, okay. But again, if somebody's not there prepping the meal for them all the time, just sort of getting up to have to make a meal. I know before I got married, as a younger individual, who wanted to make a full course meal? Now, okay, you put everything in, or I'm going to eat a meat today and I eat vegetables tomorrow type of thing in relation to the amount of prep, how much I got to clean up, what I ate during the day. So when you talk about a well-balanced diet, it does take a lot of time, thought, and preparation. And again, if you're not feeling well or feeling tired or a little depressed, it's just not a real priority for you. But there are some aspects out there that, again, people can help. Meals on Wheels, those different types of aspects that help with more of a nutritional, well-rounded base. Changes in senses, believe it or not, can make a major impact on your appetite. Vision, things just don't look so good anymore. I mean, you've seen sort of the brown diet, it doesn't look as vibrant related to that. We mentioned the aspect of taste sensation with medications, but as you get older, you actually have less amount of taste buds. So from when you were 3 to 5 to 6, how kids sort of have that, ooh, that tastes yucky. Well, they have more taste buds. It's much stronger for them. But as we get older, we don't have as many. Not only that, we want things to taste better. Salt actually makes not just a salt taste, but everything taste better, which is why there's so much salt in the diet. So they're having to want to add salt, which we got to try and keep away from. So their actual taste sensations do change. Smell, again, decreased number of receptors and aspects of hearing. I don't know about you, but meals are a real social thing when I grew up. And whenever I have a meeting, we usually have food. Okay, so it's a real social type of aspect. And hearing is actually the most isolating deficit that most older adults identify. You know, you can sort of sit there if you have vision issues and still be involved with everybody. But if you have hearing issues, it can be a real deficit because you can't join in the conversation. You feel anxious about asking them to repeat every single time. And, you know, quite honestly, if I'm there sometimes as a social event, that can get a little annoying if that's something a loved one is always doing. Oh, Mom, come on, you heard, or I'll tell you later. So again, it can be sort of self-isolating, and meal times just aren't as much, you know, enjoyable anymore. So there's those different types of things you need to think about. And then if they're living alone, transportation. If they're not driving, if they have restriction every other week or something, you can't get fresh vegetables. There are aspects that a lot of grocery stores now will deliver those type of things, but I don't know about you, but I like to choose my different types of vegetables and fruit. I want the fresh, I want the one that's firm. You never know what you're going to get, so it can be a little bit more difficult for them. Talk about weight definitions. I don't know if everybody ever heard of BMI, body mass index. It's sort of an overall view. It's not perfect by any means. I can't really use it for those that are really, really thin or those that have an aspect of big muscle mass. So bodybuilders, this is not a good one because their BMI definitely is higher. So it sort of gives us a gauge of muscle to fat type of indexes. Traditionally for, again, the average younger to middle-aged adult, BMI should be anywhere from basically less than 25. So 18.5 to 24.9. Overweight is considered 25 to 29.9, and then obese is considered 30 and over for, again, young adults. Geriatrics, on the other hand, remember I mentioned their muscle mass gradually decreases over time. So what they've identified is they want their BMI to actually be a little bit higher. We need a little bit of a buffer related to the different problems we already identified. They're not eating as much, and then we have these chronic illnesses and things like that. So most of the geriatric associations and journals are actually recommending a slightly higher, with the understanding that it's really a reflection of their muscle mass that we're concerned about. Okay. So basically for the average 5'3", older adult, about 5'5", so about 5'3". All right, that would be anywhere from 25 to 50 pounds. Okay. So, what diet is best for older adults? Again, everybody's a little bit different. Overall, it's about 2,000 calories daily. They do want, again, a low fat but a higher protein aspect. So fat should only be about 25% overall, and protein anywhere from 15 to 20. What do those numbers sort of mean? If you look online and to Healthy.gov, I believe it is, the CDC, they have a plate now. I just had too many slides. Okay, so they have the plate. How do you divide your plate? Think of it that way in relation to protein should be at least 20% of the plate. And also high fiber. High fiber helps overall in relation to the gastric system, but many older adults are not very active, therefore, and the medications that they're on gives them constipation. And if you're constipated, you don't want to put any more in there because you're just feeling very uncomfortable. So high fiber is 20 to 30. Most adults only get about 10%. So we need to, again, increase fruits and vegetables, other types of high fiber pastas and things like that would be very helpful. Now I just put this on. I don't like this one. This is the new one. They're always revising and changing. And these different sizes of the pyramid for older adults is supposed to reflect basically how much they're supposed to be taking in of it. And then they also added activity. Activity is very important. But visual, it's very sort of overwhelming. So the previous version is actually the one that seems to be more helpful and most people are looking at. So in relation to the food pyramid, is everybody sort of familiar? I remember growing up with it, and again, there's been multiple versions of it. At the bottom of that, they're still recommending, again, plenty of water. If you're looking from a nutritional standpoint in relation to fluid for somebody who's not taking in enough calories, fruit juices are a good thing. Okay, if they're always wanting to drink water, fruit juices would add a few more nutrients related to that. Water, again, is a good substitute, a good thing to take in. You'll see these little F's around, and as you identify, that identifies fiber. So they really want fiber pretty much at most every level at this point in time. So if you're talking about servings of bread, and cereal, and pasta, there are the high fiber pastas out there. Again, whole wheat bread, the whole wheat, not just wheat bread, aspects of that. The fruit group, most of the fruits will have some level of fiber associated with them, also along with the vegetables. Meats and proteins, look, there's still an F there, there's still fiber. When you talk about protein, it's not just the meats, it's the legumes, and beans and nuts, and they again have a higher amount of fiber in them. Milk and yogurt and cheeses in relation to calcium and vitamin D are very important. They also have protein in them, so there's basically 3 or more servings. And then at the little top there, you see that this, again, sprinkled throughout, because everything is sort of related, is that they want to use sparingly the use of fats and sweets and oils. Does anybody have any idea what type of oil would be best? Canola, the vegetable oils, definitely, okay. Olive oil, all those in relation to the unsaturated type of fats. Use them sparingly. Instead of, again, frying things, you're spraying it into the pan. And then at the very top, for the average older adult, we do want to consider supplements in relation to nutrition. Now, again, many years ago in the health food type of fads, they were recommending mega doses of a lot of things. That is not recommended pretty much for anybody anymore, especially older adults. So not necessarily mega doses of the vitamin E's and the vitamin C's, but a simple multivitamin in most cases is a positive thing. Okay? With caution, however, anybody with renal disease, disease of the kidneys, does need to watch out, because the average adult, in relation to the water-soluble vitamins, can urinate that out in a normal, everyday type of process. But if they're a person with kidney disease is taking a normal vitamin, they actually have vitamins for people with renal disease, kidney disease. If they're taking them, then those water-soluble vitamins can be building up in their system over time. So you need to be cautious, like I said, about some things. But overall, as we get older, our calcium stores are a bit diminished. Our hormones sort of start to affect that. So a calcium supplement is considered a positive thing for most older adults, unless you have a history of kidney stones. That's what make up kidney stones. So you do need to watch those type of things. Vitamin D in relation to absorbing the calcium, and they're recommending, I have the numbers on here if you're interested about it as we go along. And then the B vitamins. Again, as I mentioned, the gastric system has changed, and they don't absorb vitamin B12 specifically as well as you did when you're 20, 30, and 40. Okay. Does that seem doable? Okay. Again, the lower parts are the aspect that should be basically more, and then less of as you walk down or walk up. All right. So I just wanted to go over a little bit more about serving size, especially in the diet of the U.S. We have a tendency to supersize things. So sometimes you think, boy, how can I get that many servings of whole wheat in there? Well, believe it or not, the servings are small, and you might actually already be having a couple in your diet. If somebody eats a sandwich with 2 pieces of bread, well, that's 2 servings there. So you want to think about serving types of sizes. So again, the whole wheat cooked macaroni, basically a half a cup would be 1 serving size. Older adults generally don't eat a lot of that, okay? So again, think about how much they're actually eating, if they're eating enough or too much of those type of things. Oatmeal is wonderful. It has fiber, also has a bit of protein in it. Again, half a cup. If you start adding some of the other dried fruits and nuts and things like that to it, it can add, again, in relation to protein and fiber and nutrients. And again, one piece of whole wheat bread is 1 serving. So we can get those things in there. You just need to start thinking about serving sizes. Vegetables, 3 or more, until you're, again, comfortable judging some of the sizes. If you're having leafy kind of vegetables, because they take up a lot of space, but the leafy green spinach or lettuce and things like that, actually it would be about 2 cups. And a cup is usually about the size of your fist. Okay, so a nice big salad would actually be appropriate. Raw vegetables, when they're chopped, it's 1 cup. But then when they're cooked, again, they sort of cook down, it'd be about a half a cup. Dairy products, again, 3 servings or more. You would prefer the low-fat type of products. Has anybody eaten the non-fat type of cheeses and things like that? All right. I encourage you to try them. I have. I'm not a big fan, but that's me. But I can go to the lower type of version. So you'll see them shredded. You will see them in blocks. That would be better off for, again, especially the older adult. Most of them have issues with their heart and building up plaque and things like that. So, fat-free milk, again, an option. Give it a try. But again, that would be just 1 cup. Part skim mozzarella cheese, so again, using lower fat type of products. The thing to remember is that the serving size for a type of a block of cheese, 1 serving size, is actually the size of 2 dominoes. So that's not a lot, right? Okay. So if you add just 1 of those throughout the day, maybe as a snack in relation to the serving, a couple of whole wheat crackers, you're good to go. Again, it's a better thing as opposed to some of the other candies and cakes and things like that we want to always snack on, especially if you're eating them from a process standpoint. They have a lot of additives in there, and some issues are complicated as you get older with allergies or intolerances related to that. Okay. Meats and beans and nuts. A 3-ounce serving is, again, sort of a fish would be 1, and would be 1 serving, and it's about the size of a deck of cards, which if you visualize that is not very big. In fact, if I go out to dinner and that's all I get, then I feel a bit cheated. Okay, so think about, again, serving sizes. It's very doable when you start talking about what an actual serving size is. Lean beef, you actually want to diminish that a little bit in relation to size because generally the fat content's associated with it. So again, the beef type of things, you would want a smaller serving size with that. But again, beans are a fabulous way to increase some of those protein needs and fiber, and again, sometimes feeling a little full if they're having problems.
Would you say that beef itself is harder for seniors to digest?
If it has a lot of the cartilage and fat in it, then yes. But if you get, the filet mignons and things like that, generally they're easier to chew. They don't have as much of the cartilage and fibers in it in relation to eating some of those. If your older adult prefers those type of things, what is generally recommended is if you can put it in a stew where you can cook it for a period of time. It helps to soften up some of those meats. Or if you put it in, the crock pot for most of the day, those type of things can be better tolerated.
She seems to feel that the beef is too hard for her to digest, and it sort of lays heavy.
It does. It can.
She doesn't like that.
And some of that is because they're having difficulty actually chewing it up, and then it just sort of sits there. If it sits there, and again, if you're not able, the purpose of chewing is to break everything up. You actually start to digest it, some of the proteins and whatnot with the saliva. And if those things aren't mixed up real well, by the time they get to the stomach, they just sort of sit there. Yeah, you're right. Again, we can start adding eggs and things like that, either to recipes or after they're cooked, add them to various types of, I'm thinking, again, stews and things like that to increase, again, their protein intake. Fruits, mixed berries, cantaloupe, those type of things, whatever is preferred would be positive. Again, fruits and vegetables actually add water also, if you think about that, so those are positive things. It also increases the fiber. 1 cup, a tennis ball, okay, would be, again, a way to sort of visualize if you're out there trying to think about portion size. Again, the apples sometimes I buy at the store are huge, and they look very appetizing, but remember, that's probably at least 1.5 servings if you eat the whole thing. Fruit juices, 100% fruit juice would be the better option. You do want to watch if anybody has diabetes, that can raise their blood sugars. But again, a half a cup of a 100% fruit juice would have, again, the nutrients associated with it, but that would be the serving size. Again, the little fruit juice cups that you might actually get out at the diner or whatnot, that is 1 serving as opposed to the big cups that we would drink with a lot of other fluids. So, back to fluids. With most older adults and many of the long-term care facilities or assisted living, it is a major issue with their fluids. Fluids help with a variety of things. One is to maintain a blood pressure. So one of the first things that we identify for older adults is that if they're feeling very tired or their blood pressure's low, what have they been drinking? Have they been drinking over the last couple of days? Well, recently, no. Not only that, they're on blood pressure medications, which lower their blood pressure. So if all of a sudden they're not drinking as much, but still taking the same amount of blood pressure medicine, then they are feeling a little woozy, they are feeling weak, and that does put them at risk for falls, because as soon as they stand up, there's no blood to the head, they get a little woozy, and again, if they're not stopping and waiting for things, then they're going to have a tendency to fall. And we really want to diminish those type of risks, because most older adults, after they fall, have a real difficult time getting over any kind of broken hips or bones. So one serving is actually 8 ounces, which is about 1 cup. And again, what we're used to in healthcare is more of the milliliters. We do everything in metric. So it's actually 240 milliliters. So a generally healthy older adult wants to really try and shoot for almost 2 liters. And that's quite a bit. Most older adults drink 1 or less. So you want to, again, just sort of keep it around. If they're spending most of the time in the living room, is there something sitting there? If they prefer it cold, that can be a little harder with the ice, but most older adults that I find are fine with just room temperature water. As long as it's there, it's a reminder that they need to drink. However, those with heart failure or hypertension need to watch out how much they actually drink, because as we mentioned, it affects blood pressure. So many times they're on limited amounts of fluids, but we do want to keep track and make sure that they're actually drinking enough. Those clients on diuretics, things like Bumex or Lasix, the majority of them are on those. So it's not that, again, we are trying to get rid of their fluid. That is the purpose of the drug, but you have to remember you also must replace that on a daily type of basis. So it is a fine line for them. And again, I would make sure that you're talking to your healthcare provider about those things that would be appropriate for your one individual. All right. The other thing to remember that is fluid is gained from food. So if they're eating more fruits and vegetables, then again, they wouldn't necessarily have to drink the 2 liters of fluid. Does anybody know of how to sort of gauge one of those type of things in relation to whether you've been drinking enough during the day? You can do this for kids and older adults.
How often you go to the bathroom?
How often you go to the bathroom, definitely. So if you're not going to the bathroom probably every 4 to 5 hours, then you're probably not drinking enough. And do older adults, again, like to get up and move around and go to the bathroom all the time? So what do you think they do? They know. If I drink more, I got to get up. All right. So again, if they're having difficulties with mobility in relation to walkers and canes, and it's across the other side or it's upstairs, they're going to self-limit. I mean, because I will. I mean, if I'm not going to be able to get to the bathroom all day, or I have different things to do, then I'm like, no, I'm going to have to go to the bathroom. How many cups of coffee am I drinking in the morning? No, I shouldn't, because I'm going to have to go to the bathroom before I lecture. So they will think about those, as anybody will. So we need to consider those. So if that's an issue, again, how close is the bathroom? Sometimes it's a little unsightly, but again, when you talk about commode chairs and things like that, are some of the options. Or again, at night, if they're worrying about having to go to the bathroom at night, that's an issue. It can be a safety issue. We do want to limit it a little bit, probably after about 7 or 8, limit those, but again, drink more in the morning. So fluids are a major issue for older adults as they get older. All right. So that's sort of the normal type of thing. Is there any questions about it yet? I just feel like I'm sort of running at the mouth here. Okay.
It's good stuff, though.
Good stuff? Okay.
Yeah,
Well, again,
yeah.
if you have any questions about it, this is all sort of things I've been dealing with for a long period of time, so they seem sort of, yeah, kind of thing. Like, well, yeah, of course. But when I talk to my students many times, they're like, really? I'm like, yeah, this is what we're doing for a long period of time. Okay. There are certain diet considerations with the various disease processes that are common. They're not normal, but they're common in the older adult. So as we mentioned with heart disease, they actually want a low-fat diet. So again, the lean type of meats. Start replacing it with more vegetable and type of proteins would be good, the high-fiber proteins. We do need to really watch salt. You have a tendency to hold on to fluid with salt. That will complicate those that hearts aren't pumping effectively or their blood pressures are elevated. They recommend basically for the average older adult to be less than 2,300. For many older adults, we actually want that less than 2 grams or 2,000. The thing to remember is that 1 teaspoon, 1 itty-bitty teaspoon is already 2,000. Okay, so when you talk about processed foods, the different things that you're eating, and then, again, that would begin taking part of that 1 teaspoon. The average adult actually, again, young adult, old adult, anywhere from 6,000 to 13,000 if they're eating especially processed foods or things that are preserved, pickles and all those kind of things that I like for lunch have a high level of sodium. They recommend low caffeine, so it's not to say that they can't have any, they just don't want a lot. 1 to 2 cups in the morning. Again, a cup, not the mug, is not necessarily a bad thing. It can complicate some arrhythmias for those that have palpitations, so they do want to limit that. You definitely want to limit it in the evening because they'll have difficulty sleeping, and sleeping is a major issue for many older adults. And their fluids, again, are generally a little bit more diminished. So instead of the 2 liters, it's actually sort of 1.5 or 4 to 6 servings of the fluid a day. Many older adults will have asthma, may have emphysema in relation to that generation. It was very common to smoke. So within that generation, they have significant heart, lung, and probably both associated with that. Believe it or not, for emphysema, we really want sort of a lower carbohydrate, which makes up a lot of our diet, so it does limit some of the fibers sometimes they're trying to take in. When we metabolize carbohydrates, the end product actually is water and carbon dioxide, which is something for their lung condition they're already retaining. So it's difficult to get rid of that. So those that, again, are sort of that fine line, having real difficulty, sort of end stage, higher protein and fat is actually a little bit more positive for them if they're having problems with their breathing. They actually want to drink more. They want to be up on the higher end of the table because it helps liquefy any of the mucus that they're having difficulty coughing up. They may not necessarily tolerate milk products. Research goes back and forth. Some people, yes, it bothers them a lot, and they feel as if they have more mucus, and others that it really doesn't increase mucus, but again, it's more of just the feeling sometimes that we want to be concerned about. And then, especially with asthma, there's the issues of the allergy type of components that they need to be cautious about. But that's usually not something that's diagnosed later on in life. It's something that they most likely have been dealing with for long periods of time. But again, as we get older, we have lower tolerances. So the little things that they could sort of cope with when they were younger, they're having more difficulty coping with as they get older. Yes?
The considerations that you have for emphysema to asthma, is COPD included?
COPD, yeah, chronic obstructive pulmonary disease. It's included with emphysema, and so that's more of the end part of the lung, the alveoli, the little air sacs. They have destruction of that. But then there's also destruction of the bronchioles with chronic bronchitis. So with that, they generally have a little bit more mucus and are recommended to have more fluids so they can cough them up. You know, you get cold, and then again, you're not drinking as much, so it gets real thick, and you're coughing, and you can generally cough it up if you have a really good, strong cough. As you get older, again, you get a little weaker, your lungs don't expand as readily, so again, to get the air in there, to cough it out forcefully, is diminished to a certain degree, so it's a little bit harder. I was sent a couple of diseases, so I started putting them up, and I had to look at some of them. Many of them I'm familiar with. 1 or 2 I'm like, ooh, I don't know, I haven't read about that in a while. Macular degeneration is significant for many older adults now. Macular degeneration, the macula in the back of the eye is the aspect that's actually being damaged in this type. The macula is where you actually see the finer points of images out in front of you. And it's generally a central. So if you're looking forward, you can't see the middle of something. You can see the periphery, but you can't see the middle. So you'll find that when you're talking to someone with macular degeneration, they're not looking at you. They're looking this way, and they can see you sort of in the periphery of their vision. It takes a little while to get used to, but I think they're not looking at me. No, they are. That's the way they can see you. So within the macula are these tiny little cells in the very back of the eye. They rely very heavily on the rods and cones. You remember your anatomy lessons in college? Vitamin A. So vitamin A, with many of them, again, talk to your healthcare provider. There's Ocuvite and different supplements that have higher levels of vitamin A. But if you're talking about fruits and vegetables, it's the orange and yellow vegetables and fruits that actually have higher levels of vitamin A. Then there's lutein. You may have heard these on the commercials on TV. I think there's been a strong one. I mentioned Ocuvite has been coming to mind lately. They've been on the TV with commercials lately. Lutein is another one of those nutrients, and they're generally with the green leafy type of vegetables. And then same thing with the vitamin B complexes. They seem to help with sight, especially specifically with macular degeneration. Diabetes, whether it be type 1 or type 2, no concentrated sweets, basically, no the muffins and the cookies and the cakes and things like that, which can be very limiting. That's part of our major diet. I do like the occasional sweet and candy. So if I was diabetic, that would be a major shift for me. They really want, again, more of the small, frequent type of meals because they can't just tolerate the large meal with all the sugars and proteins all at once. They need more of a progressive type of thing. Most of them are on various types of medications. So if it's an oral medication that they're taking, they need to, again, make sure that they're eating throughout the day, because when they take the medication by mouth, the pills, that's actually working over a long period of time. So if I'm only eating breakfast when I take the pill, by the time lunch or the afternoon comes, my blood sugar is actually going to drop. So they need to consider and, again, talk to their nurses and doctors regarding when is this medication working, when's it starting, and when's it stopping, so that they can regulate what they're taking in. Insulins, there's many different types now. Some are very short, meaning that they start within 5 to 10 minutes, so they need to take that right before they eat. Other ones are a bit longer in relation to a half an hour, or again, they're working all day. So they need to know about their medicines and how to sort of regulate their intake. And generally they need a small nighttime snack because, again, they need to be able to regulate it from a 24-hour period depending on their medications. Does that make sense? Okay. When we talk about nighttime snacks, it's actually better with the proteins and complex carbohydrates that are going to last throughout the night. When you take sugars in, you usually use them up very quickly and very readily. We want something that's going to last throughout the night, so it's generally like cheese or a milk, a whole grain type of crackers that we'd be concerned about. Pneumonia, whether they have it, they're very high risk for it. We talked about they have difficulty, again, coughing many times when they have any kind of lung or heart disease. You do want to definitely increase their fluids during this acute type of period. Juices are better, again, because they have nutrients in relation to immunity, being able to increase some of their calories when they're not feeling well and wanting to eat. You want to increase their calorie and protein for the immunity in general. Small, frequent meals, because again, they're just sort of tired. If they're sitting up and eating a big meal, they again feel more tired. So you want to, again, do snacks between meals. And the vitamins B's and C's help with those immunity type of issues. Urinary tract infection, again, another type of infection, so it's pretty similar. You want to increase the fluids so they can flush out the bacteria, and they're going to feel a little bit better with that. Acidic type of juices have been shown to help prevent many of these type of things, not necessarily treat it, because if my bladder is already irritated and I'm putting some acid in it, sometimes that will, again, be a little bit more irritating and have more of that frequency that you have with a urinary tract infection. But some studies have identified that those acidic type of juices put more acid in the urine, therefore it diminishes the growth of the bacteria. Cranberry traditionally has been out there in relation to that, and they actually have pills now, cranberry pills, that many physicians or healthcare providers will recommend for those that actually have frequent urinary tract infections.
Is it a good idea, and I'm not sure, my mother-in-law was prone, she had to pneumonia, she had it twice in 6 weeks, and the main thing was that she not be laying down in bed too much.
That's exactly right.
She should be sitting up.
Sitting up.
As much movement as possible, because if they're not, the lungs fill up with fluid. And
Yeah,
does that
they do.
happen with younger folks too?
It does.
Okay.
Actually, anybody that comes into surgery, one of the first nursing things that we do is either get them up or they're moving, sitting them in the chair. Now, it's not to say they have to sit in the chair all day, but they need to get up. Our body, when we don't actually aerate every part of our lung, every part of the day. It sort of moves around to conserve and open up different parts of the airway. So if I'm restricting the one side because I'm laying down all the time, then I really don't aerate that very well. And then over time, it won't open up. So that's part of it. The other aspect is that when we lay down, from a gravity standpoint, sort of pushing against our chest is one way to look at that. So I'm really not taking deep breaths. And not only that, I'm not exerting enough energy to signal my body to take a deep breath. When you work out, right, everybody come up the steps, okay? That's a good thing, to at least open up the airways and keep them open. Because if they stay closed, our lungs are considered pretty much sterile. If we have a little bacteria or whatever, we cough them out. But if it sort of sits there, it starts to fulminate and it starts to grow, and then they get the pneumonia. Does that make sense?
Yeah.
So if they are, again, one of the measures that we do as nurses, if they aren't able to get up very often, then we come in the door every couple of hours to check on them. Take a deep breath for me. Did you ever see those little, what they call incentive spirometers, the little machines? It's, again, incentive. I have to bring it up to this level. I have to take a deep breath. So it's the deep breathing, not the blowing out. It's the deep breathing. So, a couple in the morning, did you take your deep breaths yet today? Okay, why don't you cough for me? Just to initiate those things and get things moving around. Okay? Good question. Again, vitamin C in relation to immunity. Vitamin C is also an acid. It's a sorbic acid, so it does help to acidify the urine related to that. Osteoporosis. I know this information is probably out there quite a bit. It is a major problem with older adults, especially women after menopause. So again, the milk, the cheeses, the yogurts, if they're going to take various types of supplements, it's generally recommended anywhere from 500 to 1,000 milligrams. With vitamin D, it actually helps to absorb the calcium. And there's more actually studies coming on of the benefits of vitamin D overall to health in relation to various kinds of colon cancers and things like that. So you may see more about that in the literature over time. Sunlight. Most older adults aren't out there much at all during the day, during the summer, during the winter. Now again, we don't want them to get sunburned, but just a little bit out there helps to convert the one part of vitamin D to the active form of that. So just going out and sitting on the porch or the sun porch or taking a walk out to the mailbox to get the mail, those type of things can be positive just from the sunlight aspect. Arthritis. There's not necessarily a whole lot in relation to arthritis with diet. However, the more weight you carry on your body over time, the more weight you're putting on your joints and the more destruction. So you'll find that if they have a low-fat, low-calorie type of diet and help control their weight within BMI and weight specifications, it's a little bit better. It is a type of inflammatory type of process. So again, anti-inflammatory type of nutrients, the antioxidants in fruits and vegetables and things like that are a positive thing. Somebody mentioned psoriasis and myasthenia gravis. Again, these are ones that I wasn't real familiar with. There's not a lot known about these as I started to look into it. Have you ever heard of Andrew, I think it's
Weil.
Dr. Weil? He's one of the more respected alternative nutrition type of doctors. He looks at the studies, he goes worldwide and compares the American diet to many others. So he's one of the more well-respected ones that are out there from conventional healthcare and medicine. And what they've identified with cirrhosis is, again, more of the orange and yellow type of fruits and vegetables seem to help with the inflammatory process of the skin. Low-fat, high antioxidants, more of the healthy fats and fish and omega-3 fatty acids. Some of those, again, supplements can be helpful. But also within psoriasis, UV, actually light therapy. So again, just getting a bit of sunlight, not too much. We don't want, again, skin cancer, but an aspect of just they actually have UV lights that are available to them to help with those skin plaques and itching and problems. Myasthenia gravis is, again, more of an autoimmune type of issue where they get very weak and have problems with their muscles. So they've identified actually a lower protein type of thing, and about 10%, and then also more of the healthy type of proteins of the plants, nuts, and fish have been helpful. No fried foods in relation to those unhealthy type of fats. Ginger or turmeric. Turmeric, again, is a type of spice, herb type of thing. Ginger, if you talk about the roots, I don't know if you've ever seen the root type of things that you can buy in the store. Added to a variety of type of things, help with that anti-inflammatory type of process. And potassium, having to do with its role in muscle movement, have been helpful. So again, increasing the diet with some oranges and apricots, bananas, very common and pretty well established there. Does that make sense? Okay. So that's more the dietary type of issues we want to be concerned about. Now you're talking about, again, their appetite, their ability to sort of do many things for themselves. You want to try to really enhance that for the older adult. So sitting up in the chair with their feet on the floor just opens everything up a little bit more. If you're sort of here and there, you're sort of scrunching up your stomach, you're just not feeling well positioned to actually feel anything. And not only that, you don't have as much control if you're, again, sort of in different types of positions. So I really want to put both feet on the floor and have them sit up. Sometimes you can sort of prop somebody up with pillows to sort of help them with that. Or if the pillow is sort of, again, up a little bit further, it's sort of like a big armchair, and they don't necessarily have as far to go. You want to consider aspect that as you get older, I don't think I mentioned in the beginning, you do have more of a dry mouth over time, and then again, many medications increase that. So you want to make sure that you do frequent mouth care, brushing their teeth at least twice a day. If they're having any kind of problems with their mouth, again, if it's painful, they're not going to want to eat. If they have dentures that don't fit well and they're sort of mucking around in their mouth as they're trying to chew, that can be an issue. So make sure that they're, again, following up with dental care. If they're having issues with that, it can really significantly impact how much they're actually taking in. Many older adults, whether it be with a disease process such as Alzheimer and whatnot, progressively actually have difficulty in swallowing. Over time, all the things that you take for granted that you don't even think about anymore, their body actually sort of forgets how to do it. If they have had a stroke in the past, many times that will affect their ability to actually swallow or talk or remember different things. So, with those that have difficulty swallowing, if you notice your loved one is having more coughing as they're eating, they're generally having difficulty swallowing. So we want to encourage that when they eat, they actually tuck their chin. Okay, they're not sitting up here straight, and they're definitely not going this way, because it will basically open up the airway, and the food will go into their lungs as opposed to their stomach. So if they tuck their chin, generally they can swallow a little bit easier. If they're having difficulty with water, there's, again, thin liquids. There are some thickeners out there. They call it Thicket. You ever heard of it? You normally get it at the drugstore. You can add it to water. You can add it to anything, and you make it more of a nectar thick or a honey thick. Anything would thicken up. And it's not supposed to change the taste of it, but it does a little bit. Okay? But if it's in a fruit juice, most people don't necessarily notice it too much. Thin liquids, again, gravity just sort of pulls it to the back of the throat real quickly, and before they can close their epiglottis, back in there to cover up the lungs, it just goes back in there and they have difficulty with that, and again, coughing and whatnot. So if you think about more of a thick liquid, they're generally a little bit better off, and if they're having more coughing, have them tuck their chin with every, again, swallow. And many times it's just reminding. It's not what they're used to. Make sure you tuck your chin with every bite. Make sure they're wearing their eyeglasses to see what's there on the table. Hearing aids in relation to, again, being able to hear different cues or what's going on in the conversation, that the dentures are fitting. And if they're having difficulty, one of the things, I don't know if anybody's familiar with Parkinsonism or other aspects where they may have some tremors, it's very difficult to hold utensils, to hold cups, and if you're spilling everything all over yourself, you're not going to be motivated to eat or drink. You do want to stay what we call more developmentally appropriate. There are sippy cups, and I've seen some people use them very effectively. But if I had people coming over to visit, I might feel as a 70-year-old a little self-conscious about that. Something that might be a little bit more age appropriate would be sports bottles. Okay, again, they're not necessarily sloshing all over. If they have difficulty tipping it over, the whole drink isn't gone. It's easier to clean up. It keeps things a little bit more contained. You do want to watch in relation to cleaning them, however. Make sure that you get the ones that open up very readily. Again, they screw off the top. You can easily put them into the dishwasher to clean them and sanitize them each time. Otherwise, I don't know about you, but some of the sports bottles, if you can't do that, they start to smell. That smell is bacteria. So we want to be cautious about that. Okay. Finger foods, you want them to be as independent as possible. If they're, again, using the fork or the spoon, those kind of things can be problematic. So if you can think of different types of finger foods or fruits that are cut up that they can actually use with their fingers, they can be more independent with that. If there's a significant change in what your loved one is eating, you need to follow up with that. It's usually something going on. It might be minute, like just a little cold that can be controlled at home, or again, increasing their fluids, having them cough more, but it could identify that there's, again, maybe something other more significant going on. Smaller, more frequent meals, if they're having difficulty eating the 3 meals that most people are to get the nutritional intake in. So think about snacks of various nuts, various fruits that might be cut up and easily taken out. Usually what I prefer to do, buy a big thing of grapes, but I like them always cold, and if I put them in the fridge, then they get sort of but I clean them all up, put them in little individual bags so that when I go to work or I just want a snack, they're just there and ready, and I'll find that I will eat more of them because they're just there and easy and quickly able to make the intake. With older adults, again, if you're having an older adult with cognitive issues, they just need more cueing, and it can sometimes, depending on the family dynamics, get a little annoying. I have to keep reminding my loved one to do that. But if you can sort of get it out of your system that that's just what they need and get it into your behavior, come on, take another bite. Come on, you can do this. And instead of looking at sometimes the emotional conflict or the emotional attachment you have to that versus it's just a cueing type of thing, I keep doing this, it's going to improve overall. They're going to feel better, I'm going to feel better over time. That can be a very positive thing. But some people find that just annoying. And again, it sort of impacts their ability to sort of have a good time at the dinner table. You need to take away from that the emotional impact that it can be, and just again sort of keep with the cueing. Issues with dry mouth, as I'm having right now. Individuals, as they get older, as I said, have dry mouth, medications, or just with their age. So avoiding caffeine. Caffeine can be a little more drying. Alcohol or tobacco is very drying to the mouth. Dry foods, obviously, sort of soaks all that up. Bulky, spicy, salty, and highly acidic foods can sometimes. So again, acids can be positive for short term, but you wouldn't necessarily want to be drinking them all day if you have a dry mouth type of issue. Hard candies or chewing gum can actually stimulate saliva, but make sure they don't have swallowing issues associated with that. Just a little bit of petroleum jelly or chapstick on the lips helps with those type of things. You can even put it on their dentures in relation to things, their lips sliding over the dentures. And just, again, small, frequent mouthfuls of water. My father-in-law needs to drink more water, and he just seems to forget. So everybody is on the playing field now. Dad, did you get your drink of water? Do you have a drink of water sitting there with you? Family events, where's your water, Dad? And he's like, yeah, I know. But unless he's sort of cued to do those kind of things by the end of the day, and sometimes he's eating the salty food that we had there, by the end of the day, he is just sort of feeling really down and dehydrated and not well. And the next day, in some cases, he's really paid for it, and so my mother-in-law. So that's part of our family dynamics now. Where's your water? Can I get you some more water? If they have problems with, again, they can't drink as much water from their disease process, ice chips can be helpful to just, again, it's there longer, and it usually makes the mouth feel a little bit better. So if you're wondering, again, how to increase some of the aspects of the different things we talked about. There are prepared shakes out there. You may have seen it on TV, things like Ensure. You heard that one? That would be for general overall, anybody that doesn't have significant problems with their diet. Glucerna is out there. It is made for those with diabetes. So again, the nutrient makeup is much different in relation to the amount of carbohydrates and sugars in it. And I don't know if you've ever heard of Jevity, but Jevity actually has fiber in it, so it's a higher fiber type of preparation. What you want to remember if you're talking about various shakes or supplements, unless you're actually adding it to the food, don't give it to them until after they've eaten. This should be in a supplement. So if they're just like little kids, if they're eating before dinner, they're not going to eat as much of their dinner. So when we talk about supplements, it's usually an hour or two after. It's their snack. There are different types of powders out there that might be available either at the drugstores or the health food type of stores. One of the ones I always recommended many years ago was just Carnation Instant Breakfast. People would drink it for breakfast, but again, it would be a supplement. It has usually tastes pretty good. It's inexpensive. Many of the other prepared ones can get sort of expensive when you're buying by the case. Yogurt is a positive thing. Again, protein has the calcium in it. It's easy to eat. It's thick. Puddings, if they have more of a preference for that. Smoothies, you can buy them or make them. Smoothies are very easy to make as long as you have a blender. You put just a 1 small cup of yogurt in the bottom. You just fill it up with fruit, whatever you want, and then just mix it up. Sometimes you can put a little honey if you need it, or a little bit of either sugar or artificial sweetener. They can drink it there as is. You can put it in the refrigerator to get nice and cold, or you can put it in individual little cups and freeze it, and it now becomes a little frozen treat. Again, very little processing on it in relation to when you buy many of the ones at the market. They have things in relation to preservatives. Adding eggs or whites, again, or adding powdered milk to recipes helps increase the protein level. And again, if you're buying the low-fat type of protein powders. Think of fruit juices versus water. If you're trying, again, having difficulty chewing peanuts or various types of nuts, there's actually spreads out there. So peanut butter on different types of fruit can be positive. There's actually more nut spreads out there. I've seen, was it Nutella? Nutella. Again, those healthy type of fats would be positive. Putting that on a whole wheat bread in the morning or in the afternoon as a snack would be very positive. And there's also more sauces out there in relation to applesauce, different other little fruit cups that are now sauces would be positive. Adding things to the bran cereal or oatmeals in the morning, as I mentioned. The craisins, again, if you're trying to increase the amount of cranberry type of things in your diet, buy them at Costco, the big thing. They don't go bad over a period of time, and just start adding them instead of the raisins to the bran cereals and other types of cereals would be positive. Because sometimes apple slices and those things are sort of tough to eat and chew. Is there any other questions about some of that, or anything that I might